Welcome. I'm Brenda Risch from the Borderland Rainbow Center, and you are at our community Cafecito called Reaching for Equity, Demystifying Social Services for the LGBTQ plus community. And we have some amazing guests for you today, and we're going to be highlighting some resources that will really blow your mind in terms of how easy and useful these ideas and these programs are to use. So I'm really excited to be getting started today. And I want to start by telling you a little bit about the Borderland Rainbow Center. We are a community nonprofit that has been in El Paso and operating for now 4 years. We're in our 5th year of service, and we're really excited to serve all LGBTQ people and their allies in this area. So we have a lot of ways in which we do intergenerational and multi-generational events, as well as specific services for seniors. So we're here to help you get done what you need to get done and feel connected, happy, and secure in this community. One of our big resources that a lot of people use is our food pantry. We serve over 400 families a week. Right now, during COVID, we've made our food pantry drive-through accessible. So you don't even have to get out of your car or talk to anyone. It's a wonderful thing. So we try to follow all of our safety rules with COVID, and we're being very careful with our seniors because we know that they are one of our beautiful treasures here in the Borderland. We honor and support our elders, and we want them to be safe, happy, and healthy. So one way we're doing that is that for elders that are at very high risk, we've developed delivery programs for our food services. So we bring our pantry food box to you every week at your home and check in and make sure you're okay. So again, using social distancing. The Borderland Rainbow Center has so many wonderful things that we've done. We offer a lot of social connection opportunities, like online video-based activities like family game night, where you can meet and interact with other people, and other kinds of services like therapy and counseling, and then also support groups for folks with different kinds of identities who might be struggling to work through what's happening in their life. So we're very proud to be serving this community, and we're very proud to be bringing this information to you today. So on that note, I want to emphasize how important it is that you're here today. If you think that you know people who might benefit, please tell them to hop on. Send them the link to register. They can still join. And you can also take notes and make a point of telling your friends what you've learned today, because I'm telling you, it's going to be amazing. There are so many resources that most people are not aware of. I myself started out as a college professor, and my second career, I became a social worker. And it was only then that I learned about the many ways in which there are resources for seniors that I was not aware of. And this was a time when I was a caregiver for my parents. And little did I know that I could have tapped into these resources for years. So I'm really encouraging you to be positive, to be open, and what we're going to be bringing you here today. So thank you again for coming. And I'm going to let our host get us started with our panel, because I want us to have as much time as possible to really hear from our amazing speakers. So thank you very much again for being with us.
Thank you so much, Brenda. Live from El Paso, Texas. Good afternoon, everyone, and thank you for joining. My name is Vivian Navas-Schellinger, and I'm the Director of Community Partnerships and Network Activation at the National Council on Aging. More than that, I was born and raised in El Paso, Texas, and where Brenda and the Borderland Rainbow Center are located, and all of your speakers that you'll meet today. Really, truly, this Cafecito marks the 3rd Cafecito in partnership with the National Council on Aging and Latinos for a Secure Retirement. But really and truly, this one hits home, literally. So I thank all of you for being here. I thank all of you for your enthusiasm through some very challenging and difficult times. Before we move on to opening our panel and getting the day started, I do want to talk a little bit about the culture in the community. El Paso is a border community that I think has similarities of other border communities, but also has a very, very, very unique identity. Our sister city as we call it, Ciudad Juarez, Chihuahua, Mexico, really sits a rock's distance away. Some people say you can throw a rock, and Mexico is right there. And I think that in and of itself speaks to the fact that when we do think about our community and we think about the diversity and the different religions and the different cultures and languages that exist in El Paso, it truly is a melting pot of culture. We think of our older adults and the role that we as service providers, both at the national level, local level, the role that we play. The reality is that COVID-19 and the pandemic that we have navigated through has really highlighted the inequalities, has really highlighted the likelihood of the inability for people, especially older adults in communities of color, to get access to the services that they need. And so we're here today to talk a little bit about the uniqueness of El Paso, the uniqueness of relationships, the tapestry of cultures, and really the importance of community-based resources for older adults, highlighting the importance of the LGBTQ community, the resources that are available to them, what the Borderland Rainbow Center is doing, their mission as they live it every day. We'll talk to other individuals from other agencies and organizations in El Paso, where truly it's a big town that feels like a small place because we are all very connected. And so I wanted to just open the conversation just a little bit, set the tone. I was reading an article the other day provided by Lambda Legal. Lambda Legal is the oldest and largest national legal organization whose mission it is to achieve full recognition of the civil rights of the LGBT community through litigation, through access awareness, resources, public policy. And, they recently highlighted that the impact of COVID-19 on approximately 2.4 million LGBT older adults over the age of 50 in the US, that the impact has been exacerbated by a lifetime of discrimination and the inability to feel confident, to feel safe, to feel accepted into environments that would likely help individuals that are not LGBT. And so those are realities that we have to talk about, and conversations we have to start having, both at the national level, as you've joined us today, locally, and at our kitchen tables. And so to embark a little bit more on the conversation, you've heard from Brenda, which I was very, very, very appreciative of her kind of just coming out with such a beautiful and enthusiastic nature to really serving the older adult community. I do want to pivot just a little bit to talking about why what we're about to talk about is so crucial. Thanks to the landmark Supreme Court rulings in 2013 and 2015 that established marriage equality, LGBTQ spouses can now claim Social Security benefits based on their spouse's work history, leave unlimited assets to each other without triggering federal estate taxes, provide coverage for each other through their workplace health insurance plans, and enjoy the same property owner survivorship rights. Through this conversation, we will share more information on the protections for LGBTQ seniors close to retirement. We'll demystify social services available for the El Paso community and share the financial benefits of marriage or legally sanctioned unions. Today, again, our panel, we're joined by Brenda Rich, Executive Director, Borderland Rainbow Center, Yvette Lugo, Director, Rio Grande Area Agency on Aging, Grace Ortiz, Faith-Based Community Engagement Specialist with Adult Protective Services, and finally, Laura Ponce, Executive Director, Project Bravo. Our panel will introduce themselves and have 5 minutes to share more about their work and the intersectionality that really helps to aid their community to age well. So we'll start the conversation. We'll actually pivot the conversation and start the conversation with Yvette. Hi, Yvette. How are you?
Let me unmute myself. Thank you. Hi, Vivian. Thank you so much. And it's good to see a fellow El Pasoan, fellow Latina on. Thank you for putting this and helping put this together along with Borderland Rainbow Center. I think definitely serving as the director for the Area Agency on Aging here in El Paso, Texas, the Rio Grande Area Agency on Aging, helps us to then connect to these particular communities, and just to make it, I think, create that awareness that your local area agency on aging is here to serve you. Our approach is that we are here to serve people 60 years and older. That's inclusive of everyone. And so I want to make sure that everyone understands that. I know that sometimes people have said we are the best kept secret because not everyone knows of us, especially when we use the acronym AAA. We all think of the American Automobile Association, but obviously in my world, we're referring to the Area Agency on Aging. And so by the title of our agency, we serve older adults and older adults who are caring for aging loved ones, caregivers, of course. And so that hits everyone. All of us are aging, and all of us will be aging, because obviously if we are not, the inevitable means what? So it is a good thing to age in my world, in my opinion. So we are here to help support that. And by saying that, I mean that the funds that we receive are here to help people to remain in their communities, to remain supported and feel that they have the support that they need to age well, and avoid premature institutionalization. So a lot of the funding that we get is provided directly through staff support. And then we do have funds that enable us to purchase services to help support that, helping people stay and remain in their communities. And so with that, qualifications for that for us mean that you are 60 and you live in our service region. For many of us on the phone right now, or excuse me, on this call today, is El Paso County, but we actually serve a 6-county region. So we reach all the way out to Brewster County. But knowing that there are area agencies on aging across the United States and territories. So if you are not happen to find yourself in our Rio Grande region, there should be an area agency on aging ready to serve you as well. So just to know that. So qualifications are that you're 60 and older, you live in the service region. We don't have a means test for accessing our services, but we will do our best to then get you onto a longer term solution. And so what do I mean by that? Sometimes people need some help with basic personal care, accessing those services. We have funds to be able to support that. Sometimes people just need being pointed into the right direction and accessing benefits. As Vivian shared, knowing where your Medicare, Medicaid, anything else, food stamps, that could then help, again, support you in your community with additional benefits and services that can help you continue to remain in your homes. When I discussed caregivers, we have a specific program that helps family caregivers continue to do their jobs. And by that meaning, we look at that caregiver and say, what can we do to help you so that you can continue to help take care of your loved one in the home? So different programming to that respect. We also have educational programs for family caregivers, helping to understand the disease process, particularly if we're looking at someone, if you're caring for someone with Alzheimer's disease or dementia, memory-related disorders. That's very important to understand that disease process. Understanding on how to manage your stress, things that we take for granted just because we are that adult daughter or spouse or partner that is then charged with having to take care of your loved one. There are things that some of us never prepared for or even thought of. And so we'd like to believe that we're actually able to then help guide you, maybe talk through some of these issues, and maybe again, connect you to resources that would better help you become that caregiver that you need to be for your loved one. We also, when this pandemic started, had to modify the way we did things. Normally we'd be out in community doing outreach, conducting our evidence-based classes that had anything to do with managing chronic diseases to fall prevention. And so we really have had to modify what that is. And so now we're looking to make those changes by doing things like this over virtual meeting platforms, over the telephone. And so just so you know, we are here to support that need. If we don't have that solution, we will definitely find that solution and connect you to the resources that are available. And I'm glad that my other panelists are here as well, because these are my community partners that we definitely work with a lot closely to make sure that we get you connected to those resources. So if we can be of help, please reach out to us, your Rio Grande Area Agency on Aging. We're at 533-0998. You can find us on the web as well. We're happy to help you.
Thank you so much, Yvette. I know all the work that you're doing at the Area Agency on Aging, not only at the local level, but on the state level. Also, the region that you cover is just vast and extremely diverse, and there is a lot of need there. So thank you so much for sharing that information. I want to go next to Grace Ortiz with the Faith-Based Community Engagement Division of Adult Protective Services. Grace, hi.
Hello, thank you so much for welcoming and having me here today. I'm really excited about being a part of this panel today. I work with Adult Protective Services and I am the Faith-Based Community Engagement Specialist. It's an agency that's very much misunderstood, and I wanted to give you an overview about what we're doing today. Next slide. Next slide. So, we have a mission statement, and it's to protect older adults, anybody who's over 65 and anybody between 18 and 64 that has a chronic disability. That disability has to affect their ability to perform their activities of daily living, and that way you'll fall under our criteria. And what we do is we focus on preventing abuse, neglect, and financial exploitation by investigating. And then once we investigate, we provide services. We arrange those services to alleviate and prevent further maltreatment from abuse, neglect, and exploitation. Next one. I want you to know that Adult Protective Services, and I mentioned to you earlier that we're very much misunderstood. Everybody thinks we're granny snatchers. Everybody thinks, you know what, we're going to call this agency and they're going to put my loved one in a nursing home. That's a total misconception. We are here to help and we want to help, and we got to find a way to get the community to know that that's what we're doing. And so the people that we serve are over 65, and I really wanted to stress that. We're in the middle of a silver tsunami. There are 10,000 people who are turning 65 a day. And so you can imagine the amount of individuals who probably are out there and need our help and don't know that they can turn to us and get that help. And then also between an individual between 18 and older to 64 that has a mental disability or a developmental or physical disability that really, really substantially impairs them from doing that. Be able to care for themselves correctly is also our client. So those two types of groups are eligible for our program. Next slide. I'm going to touch on the 3 areas that we do review, which is abuse, neglect, and exploitation. Next slide. And I just want to touch on it so you will understand what it is that we look at. The first one is abuse, which is the negligent and willful infliction of hurting somebody that's over 65 or somebody with a disability. And it can be a caretaker, can be a family member, or anyone who has a relationship with that individual who is physically hurting them. And people just are, like I said, are fearful and don't know that they can report to us so that we can alleviate this abuse from continuing and happening in their lives. Next slide. Neglect. I want to touch on neglect just a little bit, only because this is something that's very much underreported. People just don't understand it. And, there's a definition on the screen that you can see, which is the failure to provide one's goods or services. Well, it can be one. I'm getting older and it's harder for me to take care of myself. And because I'm forgetting to take my meds. It's harder for me to get in a shower or in a bath and take care of myself or to cook for myself. That's self-neglect. But then it can also be that the caregiver is getting so burned out that they're missing the mark in caring for their loved one as well. So there's 2 areas that we look at when we review the definition of neglect and figure out how we can help that individual to alleviate the situation and better their lives. The next one. So I wanted to let you all know that we have different times a year where we try to get the word out. So October is Financial Elder Abuse Awareness Month. Our motto is, if it's not your money, it's a crime. It's all about exploitation. Again, next slide. It is also about the situation that people just don't know where to report and what to do when we get our money taken advantage of with our money. Next slide. And I wanted to touch on that 3rd one, which is exploitation. It's the illegal or improper use of someone's benefits, assets, home, finances for their own gain or benefit. And unfortunately, it's happening more and more, and they're getting smarter and smarter. And my concern is last year, we only had 900 cases for the whole state of Texas. And so to me, that's a huge red flag. What are we doing wrong? Banks know that they're supposed to be reporting that to us, and they are. They're looking at anything that changes. There is going to be something on the website with signs as what to look out for exploitation. But I just wanted to stress to everyone that there's a place that you can call and not be afraid. And maybe we can help you figure out how to stop that person from taking your funds. Next slide. So our division is all about going into private homes. We don't go to the nursing homes. That's a different division. We're responsible for investigating cases of abuse, neglect, or exploitation for individuals who reside in private homes, adult foster homes, unlicensed boarding homes or care homes, where there's less than three or fewer people in those homes. So our goal is to get into those private homes and see what's going on. And people will tell us, you're very intrusive. You ask too many questions. Why are you doing this to us? We really want to know that you're okay at home. And if you're not, we're going to figure it out. And we're going to try to figure out how we can either get you services with another agency in our community, or if we can provide those services for you. Next slide. So Texas is a mandated state, and it's really serious, and people just don't get it. I'll get the call and they'll tell me, Grace, I think this is happening. So the law states that if you suspect any abuse, neglect, or exploitation happening, please call the 1-800 number at 1-800-252-5400, or you can go through the website, a link, www.texasabusehotline.org. If it's an emergency, avoid those other two and call 911 immediately. But we're a mandated state, and we should be looking out for one another. We all have friends, neighbors, family who are elderly, that are seniors, that may be going through something that we know about and are not taking action on their behalf. We need to be their voice. So if you know somebody, please report it at one of the 1-800 number or our hotline website. Next slide. So I want to stress to you that who's required to report? All of us, anybody who's age 18 or older. As long as you suspect, please report to Adult Protective Services. It's important because, we have a community where individuals are vulnerable. They're in this state. A lot of times they trust you and they tell you their story, but it's up to you to get that story out to us so that we can figure out what's going on and we can stop it and give them a better quality of life and peace of mind. Next slide. So this is the most important part to me, which is once we get in there and we review and we figure out what's really happening and we're trying to stop things, we provide services and we're there to help. And you'd be surprised all the things that I've seen that we can do. We help people find ways to find money management resources because sometimes they get in a pickle and they don't know why they're in the situation of being in debt and they can't afford to take care of themselves the way they should. So we're going to help them. Or we'll refer them over to Meals on Wheels or our partners with Area Agency on Aging and get them the meals they need. When COVID-19 started, it was crazy. My phone was going crazy because people were saying, I'm afraid to go out and buy groceries. So if I was able to, I would call Miss Yvette at Area Agency on Aging to figure out how to get them the food as soon as we could, because I didn't want them to be without the food. We get them the emergency response button to make sure that they're safe and they don't fall down. But bottom line is, our goal with our staff is we build bridges with our community partners. Because honestly, it's not APS doing this on our own, but us doing it together and making an impact with our senior community. We also assist with home improvements. You'd be surprised. I have calls again where people will say, look, I live in a mobile home and I need a ramp to get in and out. Well, then you know what? We're going to figure out how to get you that ramp to get in your house. Or you tell me my dad is really, really ill. He's declining rapidly and we can't get him in the shower. Well, then let's figure out how we can get you a walk-in shower. And we work together with different partners, with the Veterans Association if they're a veteran, or with APS. But we're going to figure out how to convert your bathroom, your shower, bathtub into a shower. We're going to figure out if you have a safe living environment. And if not, we're going to make it safe for you. We'll purchase medications if you can't afford them. Report it to us and we'll figure out how to help you with those medications. And honestly, we're going to figure out how to intervene with your safety. If you're in bad situation with either family members or situations where we just don't know these relationships that you develop where they're taking advantage of you, we're going to take precautions and figure out how to get you in that safe environment again. And lastly, one of the things that we do also is if that individual is no longer able to make decisions and there's no family, then we're going to figure out how to get a guardian over you and we'll make that referral to guardianship. Bottom line is we're here to build that bridge and help that senior get the services they need so they can live a better life. Next slide. Again, report abuse, neglect, and exploitation to that 1-800 number. I want to say thank you for letting me be here and letting me talk about what I'm very passionate about. As you can see, I have lots of people who call me, but honestly, it's not you calling me, it's you calling that 1-800 number, or you getting on that link and making a report, because we're here to help and our staff is here to help. The area that we serve is El Paso and all the 6 outlying counties, which is Brewster, Culberson, Jeff Davis, Presidio, Marfa. We want to be out there to help as well. And believe it or not, we do help out there. Next slide. Thank you so much for giving me this opportunity, and I'm really excited to be here. I'm hoping that I make a difference, and hopefully someone will call and know that APS is there to help.
Thank you so much, Grace. I really, really appreciate what you've highlighted. You know, there's so many challenges that are posed to older adults, so many challenges that are unique, I think, to the border community, but also, you know, but also very similar to what's going on across the country. Caregiver burnout you brought up. You also brought up just kind of navigating relationships and what that means, being socially distant, but also making sure that we're there for our older adults. Before I pivot to Laura with Project Bravo, I just wanted to say that I think, Grace, what you highlighted was a real cultural concept that I know the border region knows very well, of cariño, what that really means. It's to show love, to show appreciation, to show kindness, to show care, to show that you are there. And so you really, truly have, as organizations today, built a bridge, and you really are showing and you're living that type of cariño for community every day. So thank you, Grace. Laura, I want to move on to you to talk a little bit about Project Bravo and what you're doing in the community.
Good afternoon. First of all, thank you so much for having me here. I feel very honored to be able to speak to this community, because I know that everyone here is an integral part of our community, and we want to make sure that people understand that our services are for everybody in the community. We're here to help. We want people to come to us, and these are services that they're entitled to, because, you know, if they meet the criteria, which typically are income criteria and living in the county, these are services for you. And so just a little bit about what Project Bravo is. We are your local community action agency. There's actually a nationwide network of community action agencies all across the US. Every community is covered by a community action agency, whether it is a nonprofit organization or a governmental entity. So I'm going to be talking about some programs and services, but in your community, if you're not here in El Paso, just look up Community Action Agency and your town, city, county, and you'll see that there's an agency there to help you. Our program was founded in the 1960s, 1965 to be exact, when the community action movement started. And so we receive federally designated funds that are specifically to fight poverty in our community. And all of us, all over the United States, we create programs and services that are unique to our area so that we can make sure that we meet the needs to the people that we serve. And so no community action agency looks the same. And so just kind of with that information up front, just a little bit about what we do at Project Bravo. We have a lot of programs and services. The majority of them are for people that are low income. And so right now, low income is 100, it depends on the program. So we get a lot of different programs, different funding sources. And what we do is that when people apply for services, we look at their income and kind of where they fall on the income threshold. We identify the needs, and then we connect them to those services. And so if you go and apply to our services, you're going to see an application. It looks a little long. It's a lot of check marks. So it's not like you have to fill out all those pages. You just need to check. But what that allows us to do is to connect you with all the resources that are available to you. Our most popular program is our utility assistance program. A lot of people don't know that if you are eligible for utility assistance, you could get 6 months or 12 months of your utilities paid for the calendar year. And so 12 months are for our vulnerable populations. And those populations are people over age 60, people with disabilities, and households with children under age 5. And so this is up to $1,600 worth of benefit to get your gas and your electricity paid for for the full year. And so when people are on fixed incomes, we have a lot of families that they have a lot of pride. They want to, pay all of their bills on their own with their retirement income. But if they're income eligible for this, this is something that you really need to take advantage of, because it allows you to free up your money so that if you have an emergency, you'll have money saved in the bank for that. It'll allow you to have money for other things like medicines or food, or just, just to have a nice night out, whatever it is. But if you're income qualified for these services, take advantage of them when you're over the age of 60. We now are able to help people with up to $250 for water, and that's for if people have fallen behind on their water. So that's another utility assistance program that we have. Another program that, let me just get my little screen up, because another program that is actually the Career and Academic Readiness Program. I know that many of you are grandparents parenting grandchildren, or maybe you have a multi-generational household, but we actually have an intensive case management program where we're able to pay for training and all the supports needed for somebody to get through a training program. So people need to be in a training program that's a year or less. We can pay for the licensing exam. Maybe it's a trade and you need steel toe boots. So there's all sorts of things that we can pay. It's a small caseload of people, but if you get into this program, we are going to work very closely with you and your family to make sure that you have everything you need so you can complete your training program. And then on the other end, GED classes. People don't know that we offer free GED classes and we pay for the test, which can be a little expensive. Our oldest graduate from our GED class was in his 70s. So it's never too late to get your GED. And if this is something that you've always wanted to achieve, you can do it through Project Bravo. You could do it for free. And we have a very flexible program. Another program that we have is our affordable apartments. We have affordable apartments, 36 in the central area, and the rents range from about $350 to about $650. And these are 2 to 4 bedroom apartments. And so people can income qualify and see what rent they would be charged. People do need to get on a waiting list, but if, let's say right now you can't afford the apartment you're in, or you're barely able to afford it, get yourself on the list and you may be able to move into one of our apartments. Another program that we have that people are not aware of is that we're actually able to fix furnaces and air conditioners, because this is considered a health and safety issue. There's a lot of people in older homes, their air conditioner is falling apart. They've got a swamp cooler, it's rusted out. As long as the expense for repairing, for replacing the air conditioner is, I think, less than about $3,000, we actually can replace air conditioners. For furnaces, we can fix the furnace, we can't replace it. But the other thing is that we have a lot of families that 1 year we fix their furnace, the next year we replace their air conditioner, and then they still keep coming back because we can also do the startup. So we have a lot of people that they make sure every year they get their elder person signed up, because they don't want to see their 80-year-old dad on top of the roof trying to turn on the air conditioner in the middle of the summer. So this is a great program, and we encourage people to sign up early in the year. That way they can get themselves programmed for their startups if they have perfectly fine air conditioners and furnaces in their home. Another program that we have is called weatherization. And so weatherization is the science of making homes more energy efficient. So we invest anywhere from $3,000 to $10,000 into a home to make it more energy efficient. And so we have this program has a priority for households where there's somebody who's older than the age of 60, somebody who has a disability, or somebody who has a small child. So these families will actually get bumped up on the list to get served first on this program. And we do this especially for families on fixed incomes, because that's where you can see a lot of savings. So if you're able to get your electricity and gas bills down, then that puts more money in your pocket and it makes it more affordable. Plus, your house is not overly hot or overly cold. We have so many people who live in mobile homes that take advantage of this program, and it makes a huge difference. We have people that built their own homes outside of the city limits and that are made of concrete, and they also get services with this program. And I think the last thing that I want to talk about our general programs and services is our HUD certified housing counseling. So we are one of 2 agencies in the city of El Paso that has a HUD certified housing counselor. What does this mean? If you are wanting to buy a home, we can do the counseling and education so that we can make sure you get into an affordable home. Plus, you can use the certificate we give you to take advantage of down payment assistance programs that are out there. The other thing that we do is we help people who are at risk of mortgage default. There's a lot of people that their income changes and then they can't afford their mortgage. So we are able to negotiate with the bank to see if you can get a lower payment for your mortgage. And so these are all just, some of the services that we provide at Project Bravo. And they're typically for people who are low income. But if you apply, we'll let you know if you qualify, and we'll try to sign you up to as many services as possible. So thank you so much for the opportunity to speak.
Thank you so much, Laura. And if you can put that website in the chat where you were referring to these services and programs, if you're able to do that, that would be great. So that way people who are watching can access that very quickly. Thank you so much. You talk so much about all of the support systems that are out there. But really what you highlight is the resiliency of a community that really is going through a lot and has been through a lot in the last year. And I think part of that resiliency and part of, talking about the services that you provide, the services that everyone here provides, and thinking about, our friends at the Borderland Rainbow Center. Before we close off the conversation today and transition to the next part of our Cafecito, what we've seen is that older LGBT adults have really demonstrated resilience, and that's why resilience keeps running through my head. They've demonstrated that strength through their history. But I do know that there are ways where allies and the community at large must continue to stand beside our LGBT older adults. I want to close off with Brenda at the Borderland Rainbow Center, just to talk about one way in which her organization is helping LGBTQ older adults, maintain resiliency and hope during some challenging times.
I think the most important thing that the Borderland Rainbow Center can offer seniors is not the specific services that all of these people have outlined. It's really that friendly helping hand. So when you're confused, when you're overwhelmed, when you're unsure if you're going to get a warm welcome, we're there to help pave the way for you. So we are here to facilitate this process and help you figure out what's going to be most appropriate for your elder or your senior in your life, or for you yourself and your partner. So many times we do so much education with folks about what they could be eligible for, and they're stunned. They're just stunned to find out that marriage equality isn't just something for young folks. And even if you've been in a committed relationship for 30 or 40 years, there might be really tangible, important, life-changing benefits by having that union recognized legally. Your family and all of the most important people in your life already acknowledge that you're together. But here we can say, hey, look, think about the financial sides of this. Think about healthcare, right? So we're here to help you untangle what's going on in your life and figure out how to move forward. Also, one of the other things we do is we provide LGBT sensitivity training to the staff at all these places. So if you're having an experience and it's not great, you let us know and we'll go in and do a refresher. We'll do a training. We'll help people fine tune their customer service, get them up to date on what the most current best practices are. We're here to educate and support our supporters and our allies throughout the whole community, right? And we now have online courses that people nationally are using. So our resources on our website, our training website, driep.org, I mean, they're for anyone. We have a lot of things that are open to the public for free. So spreading education, informing, and supporting, that's where we come in. And then, of course, for all of the nitty-gritty everyday things, come check with us. We're your LGBTQ family that you've been looking for. That's who we are at the Borderland Rainbow Center. Thank you, Vivian.
Thank you. Thank you so much, Brenda. In closing, thank you to our panelists for sharing their expertise, their insights, giving a bit of a flavor of home. And really, as we wave goodbye to our panelists, we want to welcome all of you watching today to watch a quick video showcasing the National Council on Aging Benefits Checkup Tool that you heard a little bit about today.
Are you living on a fixed income? You may qualify for benefits that can save you money and improve your life. There are thousands of programs available, but most people don't know about them or how to apply. That's why the National Council on Aging, a trusted nonprofit that has been serving older adults since 1950, created Benefits Checkup. BenefitsCheckup.org is the most comprehensive and completely free online resource to discover what benefits might be waiting for you. Every year, millions of people use Benefits Checkup to find benefits worth billions. After answering a few simple questions, Benefits Checkup gives you a personalized list of programs you may be eligible for, plus the steps to apply. Join the millions of people who have used Benefits Checkup to stay healthy, secure, and independent. Visit BenefitsCheckup.org today and start finding benefits to boost your budget.
An estimated $30 billion.
It's Hispanic Heritage Month, and we want every person to have the resources available to navigate
It's Hispanic Heritage Month, and we want every person to have the resources available to navigate their health and financial security and independence. We're proud to have created bilingual materials and resources that can help every individual navigate the benefits they deserve.
Hi, everyone. Hi, everyone. We're back again. Apologies on my end. Estimated $30 billion in public and private benefits go unclaimed every year because older adults don't know about them or how to apply. The National Council on Aging, Latinos for a Secure Retirement, and the Borderland Rainbow Center are leveraging people power and digital power to connect eligible older adults to programs that help them pay for food, medicine, rent, utilities, and more. COVID-19 has had a severe impact on older adults, their health, both physically and their financial security. Now more than ever, it is time to explore how they can boost their budgets with benefits. For older adults living on a fixed income, benefits like the Supplemental Nutrition Assistance Program, or SNAP, and Medicare Low-Income Subsidy can make a huge difference in supporting their desire to stay healthy, economically secure, and independent in the community. Having access to benefits programs means our older friends and neighbors do not have to cut pills in half. They don't have to skip meals or turn off the air conditioner in the middle of the summer in order to make ends meet each month. We are here to help older adults understand what benefits they may be eligible for and take the steps to apply. You can go to BenefitsCheckup.org to check your eligibility or that of a loved one. Let's show you how NCOA's Benefits Checkup Tool works.
You've worked hard. Long days. You've worked hard. Long days. Year after year. Decade after decade. You've seen a lot of things. Enjoyed the good times. And weathered the tough times. You've earned a life that you can call your own. alongside the people you love the most. Retirement worries shouldn't get in the way. But many Americans like you are finding that retiring on a fixed income is harder than they expected. Fortunately, there are thousands of benefits programs that can help. Visit BenefitsCheckup.org to see if you're among the millions of people eligible for thousands of dollars in benefits to help you age well, so you can focus on what's really important. Benefits Checkup. You've earned this.
A little bit about county-wide resources with the Borderland Rainbow Center with Yvette Lugo from the AAA in El Paso. And we'll also talk a little bit about those county-wide resources, just to recap our conversation with Laura from Project Bravo. So let's welcome back Yvette to share some of those resources for people affected by the pandemic and trying to navigate their way through it.
Yes, thank you, Vivian. Obviously, our community is highly affected. I mean, I'm so nervous about the numbers that continue to go up. And we know that this disproportionately affects older adults in the ways of affecting their health. And so in researching and looking at what would be the best way that we could support that, gratefully, we received funding from the federal government to be able to provide supportive services to those particularly affected by COVID, and obviously through our agency working with older adults. And so looking at that and researching, speaking to our community partners, many of whom are on with us today, we appeared that since area agencies on aging are already assisting with the home delivered meal programs and the congregate meal programs at Senior Center, that food and nutrition is a big part of what helps sustain us and, again, aging well in our community. And so we have expanded that program to then allow for additional home delivered meal participants, people who perhaps might not have qualified before, when some of the regulations to qualify for a home delivered meal were in place. Those have been relaxed somewhat. And so we've expanded that. So if anyone is in need of a home delivered meal, that we, through our community partnership with the county nutrition program, are able to then purchase that for you. We've also established a partnership with our local El Pasoans Fighting Hunger Food Bank to help deliver food boxes to older adults on a weekly basis. And so this is something very new to us, something that we were able to do because of the additional funding that we've received, because that's not something traditionally area agencies on aging do, but through, again, these special funds that we've received, we're able to then establish that partnership. And so that was really important for us to continue to provide and help meet those nutritional needs for older adults, because those are things, as Vivian shared, can go by the wayside if you're having to spend money on additional things or medications, et cetera. And so food and nutrition is a very key element to being able to age well. As a side note, we know that right now open enrollment for Medicare beneficiaries is occurring. And so that's something that we at the Area Agency on Aging can assist you with. So if you find yourself in need of making a change to your Medicare plan, or just want to ensure that you have the right plan in place for you, and you happen to be a Medicare beneficiary, we then can assist you. We're doing virtual meetings, we're doing things over the phone, and if necessary, we can bring you into the office to do that for you. But just know that you would receive an unbiased piece of information in partnership in helping make sure that your Medicare plans are the right ones for you. So please come see us. Obviously, there's no charge for our services. And handing it off to my community partner, we Loud Up Once with the Project Bravo. They also received additional funding, but I'll allow her to then explain what exactly their niche is for this particular response to COVID-19 in our community.
Good afternoon. And so just Project Bravo, because we received federal funds, we received designated funds, and then we also applied for additional funds. And so for families that are affected by COVID, and so that means that a family where either the income was reduced as a result of COVID or expenses were increased because of COVID, are eligible for special benefits. So these are not benefits that are available to the general population that's low income. Also, the income threshold is a little bit higher. So for example, with most of our programs and services, people have to be at 125% of the federal poverty or level or below. For these services, people can be at 200% of the federal poverty and below. And so the big program that we have is our rental assistance program. So we're able to help families with up to 3 months of payments, maximum $1,000 per month, which means maximum benefit of $3,000. And so that's for rental assistance for rent that is past due. We can't go into future months with that unless you have an anticipated drop in income. So for example, let's say that you got rental assistance for past due for 2 months. You still have 1 month that you didn't use, but you just found out you have COVID and you know you're not going to be able to work. Then you can work with us and we can do the additional payment so we can max out that payment. We also provide mortgage assistance. And for that benefit, it's also max 3 months. It can only be on mortgage that's past due. And the maximum cap on that is $3,750. Another program that we have that's in cooperation with the El Paso Community Foundation and the city and the county of El Paso is that we have a limited use debit card with a value where people can use this debit card. They can only use it at grocery stores, pharmacies, and supermarkets. But for people living within the city limits, the debit card is loaded up to $2,000. For people living outside the city limits, in the county of El Paso, it's loaded up to $1,000, but we're working on getting it up to $2,002. So just know that that's another great benefit that's available. Yes, Vivian?
No, I think you're maybe it's my internet connection is we're having a little bit of technical difficulty, but I can hear you.
Okay, great. And then finally, the program that I want to announce that just began. So this is a program that was just dreamed about not very long ago that was mandated by the governor and the Supreme Court of Texas, and it's the Texas Eviction Diversion Program. So right now there's 9 pilot programs across the state of Texas. And so we are embarking on how to do eviction diversion in collaboration with the Justice of the Peace Courts. So that means that when people go to an eviction, we're coordinating with the Justice of the Peace Courts to see if we can come to a resolution and pay for their rent that's back due. The great thing about this program is that it's 6 months of rental payments and we can cover future payments. And so that program, we just got the contract yesterday. We just did a training this morning with the Justice of the Peace, but to access it, people can only access it through the Justice of the Peace. They're the ones that do the referral, and that's after they've gone to eviction court. And the judge has a talk with the landlord and the tenant and explains the program and says, do you want to see if you qualify? Then that comes to us and we qualify them. The great thing about this program is that the application for this is not as long as our regular application, but if people want to get all the other benefits like the community card, they would have to fill out our regular application. But what we do is that at that time, we do the quick application, we see if they're eligible, we pay their rent, we stop the eviction, and then we continue to work with the tenants so that we can get them back on their feet. And so those are the programs that we have for COVID affected families.
Thank you so much, Laura. You highlighted, you touch a lot of programs that I know. If I know anything about the community, it's that we do as much as we possibly can with whatever it is we have. And so the resourcefulness of these organizations, I hope you all that are watching today can see. And again, the cariño, the love, and the dedication. Just to close off our conversation, just in a minute or two, I want Brenda, I want you to highlight your buddy program before we close out the day.
Excellent. Thank you so much. Our buddy program is something that we started here during COVID because we noticed that people were a lot of our seniors who are still active and come to pantry, they would socialize and they would get that contact and have regular friends that they would touch base with. But when our pantry shut down to foot traffic, the majority of foot traffic and became drive-through, a lot of seniors were left very isolated. And also for some folks with coexisting conditions, it wasn't even really safe for their family to be coming and going, especially if their family were essential workers, right? So even like the normal family supports people would have, they didn't have. So we started a training process for people to sign up, to become telephone buddies. And so you can determine with your buddy, like how often you're going to touch base, once a week, twice a week. We guide people on what acceptable topics are. We give some ethical guidance and some support, and then we check in periodically to see how paired up buddies are doing. And so it's a wonderful way to use very simple means to reach out and support folks. So for folks who are, retired, who are furloughed, who are unemployed right now, this is a wonderful way to give back that will not endanger you in any way. You don't even have to leave your own home to provide the support to someone. So if you're interested, please contact us. You could visit our Facebook page, our website, or email us at contact@borderlandrainbow.org. And we have just so much joy about this. I do have one serious thing I want to mention, though, and that is that the Borderland Rainbow Center also has a role in advocacy. And yesterday, 2 days ago, the governor interfered with the process at the coordinating board, at the code of conduct for social workers in the state of Texas. And they proposed and passed a rule in our social work board that says that social workers are no longer obligated to provide services to LGBTQ people without prejudice. So now providers can decide they don't want to help you. That we are fighting against. We find that a violation of our National Code of Ethics. The entire state of Texas, social workers are up in arms, and we are going to address this issue because LGBTQ people deserve protection under the law for equal service by all social workers and other social service and medical providers. So although we're happy and we're friendly and we are your family, we're also out there in the streets fighting for you to make sure that your rights are being addressed. So Vivian, thank you for letting me talk about our buddy program and highlight some of the great things that have happened, but we're also on the watch for people that are trying to infringe on the rights of our seniors, our youth, and our folks in the community. Like, we will not let this happen on our watch. Thank you.
Thank you so much, Brenda. Thank you so much for highlighting just the many ways that you are there for the community. Thank you to all our speakers, to my friends back home, to all of us watching today. I do urge you to visit www.benefitscheckup.org to see if you or an older friend, neighbor, relative can find benefits to boost your budget. It's completely free, and you'll leave with a personalized report of the benefits that you may qualify for. And let us know if you need help in boosting your benefits today. This partnership was brought to you by the National Council on Aging and Latinos for a Secure Retirement to bring resources to help families apply for money-saving benefits through the NCOA Benefits Checkup Tool to, again, go to the heart of our mission as a national organization for older adults to live with dignity, purpose, and security. Thank you, everyone, for joining us. We want to remind you to visit latinoretirement.org/community to RSVP to our next 2 Cafecitos happening in November, co-hosted, one by LULAC, the League of United Latin American Citizens, and the Alliance for African American Health of Central Texas. We'll end the conversation with a video on healthy voting and our CEO, a message from our CEO, Ramsey Alwyn. Hasta la próxima. Take care. Be well.
Are you living on a fixed income? You may qualify for benefits that can save you money and improve your life. There are thousands of programs available, but most people don't know about them or how to apply. That's why the National Council on Aging, a trusted nonprofit that has been serving older adults since 1950, created Benefits Checkup. BenefitsCheckup.org is the most comprehensive and completely free online resource to discover what benefits might be waiting for you. Every year, millions of people use Benefits Checkup to find benefits worth billions. After answering a few simple questions, Benefits Checkup gives you a personalized list of programs you may be eligible for, plus the steps to apply. Join the millions of people who have used Benefits Checkup to stay healthy, secure, and independent. Visit benefitscheckup.org today and start finding benefits to boost your budget.
If you're like most older adults, you have a long history of voting and a strong commitment to voting. This year is unique, and we want to make sure you're voting safely. We've partnered with We Can Vote to provide you resources to ensure you're voting safely. If you're like most older adults, you have a long history of voting and a strong commitment to voting. This year is unique, and we want to make sure you're voting safely. We've partnered with We Can Vote to provide you resources to ensure you're voting safely.